It's what's called a hybrid operating room. It is the place of business for Dr. Eric Dehaies. He's a neurosurgeon who joins us right now. So nice to see you.
Morning, nice
Why
to
is
meet
it
you.
called a hybrid operating room? What's so special about it?
It's a combination of an operating room and a room where you can do radiology procedures, so minimally invasive procedures. As opposed to having those rooms separate, you can do both maximally invasive and minimally invasive neurosurgical procedures to treat diseases of the brain vessels.
Okay, so it's a lot easier on the patient as well as you in terms of logistics.
Much easier, and it also allows us to do many more procedures that we can't do if the rooms are separate.
Okay, you have something very exciting that you're working on. We all fear strokes. I mean, we really do. And you have a way of retrieving the clots now that are a lot simpler, well, not simpler, but a lot more easy on the patient.
That's correct. In the past, people have been able to get the clot-busting drugs called TPA in the veins, and that is still done for a majority of patients. However, once they're out of certain windows, beyond about 4.5 hours from the time that their stroke symptoms started, there was no therapy available to them. But now, what we've had evolve is the technology so that we can actually go in out to 8 hours with small devices using just a little needle stick in the artery in the leg, and then remove the clot from the brain so we can get blood flow back to that area of the brain and lower the risk of the patient having a stroke.
That is awesome. You brought what you work with. This is fascinating. Let's hold it up and show.
Correct. We have a small device that we use in patients who have had strokes.
Okay.
And it's a little stent. We call it a stent on a stick. And it looks like a little chicken wire fence.
Yeah, can you see it coming out there? This is what goes in the leg, right? In the artery.
So from the artery in the leg, we put this all the way up into the brain by using X-ray guidance in this hybrid room.
Okay.
We deploy this across the blood clot. It immediately restores blood flow to that area of the brain.
Okay.
You wait a few minutes, and then that chicken wire grabs the clot.
This mesh, essentially.
The stent, and then we're able to pull the clot out.
Oh, that is awesome. Which, as you say, restores the blood flow, reduces the risk of paralysis and further complications.
That's correct. And there's new data that just came out in New England Journal of Medicine last month showing that if you use this technique in combination with the clot-busting drug, patients have significantly better outcomes.
That is really incredible. But as you say, people have to get to the hospital when they have the symptoms of stroke in time.
You have to recognize the symptoms of stroke. That's absolutely critical because time is significant. The longer you wait, the less likely any therapy we provide is going to help you.
Okay, so if you don't know those symptoms, it's disorientation. Go ahead.
Disorientation, difficulties with speech or understanding other people talking to you, numbness, weakness in the face, the arms, the legs.
Distortion on one side of the face sometimes.
Distortion, correct. As soon as you recognize those symptoms, you need to get to the emergency department.
That's right. False alarm is better than waiting too long, no question. Doctor, thank you very much. Dr. Dehaies is at Crouse Hospital. And by the way, Crouse is putting on an event this Wednesday if you want to know more. It's for ladies only. It's kind of a health fair, night out kind of a thing, but he's going to speak about prevention as well as treatment of stroke, and it is especially relevant for women because women are more susceptible.
Yes, absolutely.
It is at Drumlin's on Wednesday evening, and if you would like to go, it is free, but they do ask that you call ahead. Thank you so much for coming in.
Thank you for inviting me.